I paged the Children's Hospital of Philadelphia and I said, we're going to leave Hershey and we're coming down to your hospital and giving you her full care no matter what, because we know that you are a big research center and that you have more options. And I'll never forget the doctor said, it's amazing that you paged me today. The last email I read yesterday was giving us permission to try CAR T cell therapy, and it's never been used on a child anywhere in the world. And we think Emily could benefit from it. So we transferred down to CHOP on March 1st, 12, and we met Dr. Stephen Grupp and his team, who explained to us what CAR T cell therapy was.
Was genetic testing offered at any time?
Yeah, that was part of it. And they had, they just said our research here is some of the best in the world, and we'd like to extract Emily's T cells and do every kind of genetic testing and modification, because they said if her T cells will grow for this trial, we need to do a growth test first, and then if they will grow, then we can take them off to the lab. And what they described to Emily is we're going to genetically modify your own T cells and turn them into an army that will come back in and fight against your cancer cells and hopefully eradicate them.
I'm amazed by the bedside manner and just the giftedness to be so empathetic and explain such complex things in such a simplistic way, even to children as they did for you. But how did the trial go, and what was the healing process like?
Okay, so after he described to us what they would do, then it was time for a consent. And we signed that fairly quickly because the other option was go home and enjoy the days you have left with her. But the next thing they did, they sent her to surgery and they put a catheter in her neck to extract her T cells, and that allows the blood to flow out into the machine and then back in through the catheter after they put her blood into a centrifuge and spun out the white T cells. So they did that around March 6th after we went down there March 1st, and then they gave her the harshest round of chemotherapy that she had received because they had to slow the cancer down so she could survive the 6 weeks that it would take to genetically modify her T cells. And they gave her clofarabine was the name of the medicine, and that completely wiped out her immune system. And then she had to stay in isolation in her hospital room for 6 weeks there at CHOP while they took her cells to the lab and genetically modified them. And then it was a great day for us, whenever Dr. Grupp came in and said April 17th is going to be day one, and we have no idea what's truly going to happen because it's never been tried on a child. So we're going to give her 10% of her own cells back on April 17th, and we'll give her 30% of the cells that we feel she needs on the 18th. And then if everything goes well, she'll get the rest of the dose on the 19th. So it was huge for us because during that 6 weeks, they told us if she even gets a common cold, she can't fight it. It could take her life. So you can't bring germs in the room. And it was very stressful waiting for that to happen. So, but then they did give her 10% of her cells on April 17th, and we allowed, a film crew to come in the room with us because I didn't know any other way to look at it other than, she's going to change the world. So, we want footage of this. So the PR team asked, can we have a film crew follow you that day? And I said yes, and that wasn't easy to do either. But like I said, I'm a positive person. I didn't know any other way to look at it. But day one, she got 10% of the cells, and nothing happened, which is good. Boring days in the oncology unit are good days. And day two, she got the 30% of the cells, and we actually left the hospital and went to my sister-in-law's in Wilmington, Delaware, until around midnight when she spiked a fever. And at that point, we weren't comfortable being outside the hospital, so we went to the ER and waited till morning. And in the morning, she didn't have a fever, felt fine, and Dr. Grupp came in and said, "It's your call, but we feel that this would give her the best chance if she gets the rest of her cells," and we agreed to that. And then we kind of went through the worst part of her treatment. We found out later that every genetically modified CAR T cell can kill 1,000 tumor cells. And when they put those cells back in her body, She weighed around 68 pounds, and 3.5 pounds of her body weight was cancer. So there was so much cancer dying so fast that it overwhelmed her system, and she had what they call cytokine release syndrome, or a cytokine storm, when your immune system just goes crazy. So within 24 hours of getting her last dose, she was hallucinating, she was having severe pain, she was having breathing difficulty, blood pressure difficulty, and they ended up taking her to the intensive care unit and putting her into an induced coma on a ventilator, breathing for her, and she remained that way for 14 days. So, very brutal. Um, but we started a blog on day one, and we kept that blog the whole way through. And at that point, it was just asking people to pray for her if you pray, or send positive thoughts, and that really helped us through that time. But maybe around the third day on the ventilator, the head of the PICU came in the room, and he said, we're the biggest PICU in the country, pediatric intensive care unit. Almost every child we put on a ventilator gets off. Unfortunately, we don't think Emily's going to get off, so you might want to call your family in. And I said, well, I know that she's going to change the world, so please keep trying to help her, because I'll see you at rounds tomorrow. And he pulled me into the hallway and looked at me like I was the most naive parent in the world. And he said, there's a 1 in 1,000 chance your daughter's alive when the sun comes up. You better call your family in. And I said, okay, I'll see you at rounds tomorrow. And the next day, he came with his group of young doctors and said it's medically hard to explain how Emily's still here, but that's why we never give up on a child. And within an hour of that, Dr. Grupp showed up and said the team and the lab stayed up all night identifying what's wrong in Emily's system. And we found this protein that's 1,000 times higher in her system than anybody we've ever seen. It's off the charts. And we happen to have an arthritis drug. We have 2 doses of this arthritis drug that's never been used on a cancer patient that takes that protein down, and we feel like it could give her a chance. And that saved her life. So that medicine was called tocilizumab, and they gave Emily that medicine, and within hours we were hearing the nurses say, we've never seen a child this sick get better any faster. And they were, and I posted online, I believe I'm witnessing a miracle. And she came back to us then, and woke up on her 7th birthday from that 14-day coma. And that would be May 2nd of 12. And then 8 days later, which is 23 days from her first dose of CAR T cells, they checked her bone marrow, and she was completely cancer-free.